Next we have Dr. Vikram Byre, Senior Consultant, Orthopedic Surgeon, Yashoda Hospitals. A specialist in robotic joint replacement, complex trauma and sports medicine. He is recognized for delivering advanced orthopedic care with a strong focus on precision, innovation and exceptional patient outcomes.
Hi, I'm Dr. Vikram Byre, Senior Consultant Orthopedic Surgeon from Yashoda Hospital, Hyderabad. I'm specialized in robotic joint replacements. So, how we have evolved over the time. So, we have started around 30-35 years back with conventional joint replacements, and today we are here with robotics, and future will be all about AI. So robotics is all about precision, personalization and proper alignment of the implants. So this is going to be the future. So how orthopedics has evolved over the time. It was initially with all about mechanical alignment and precision guided personalized procedures. Joint replacement surgery has transformed patient mobility, pain relief and quality of life. The technological integration now includes navigation, robotics, artificial intelligence and data analytics. So it all started in 1890. This was basically to give a pain-free joint to the patients. It was started with ivory prosthetics, and later in 1940 Austin Moore has started with metal prosthetics, and late 1962 the pioneer in orthopedics Sir Chanley has started with low friction arthroplasty, which has given, and we're very thankful to Chanley because we are still using that technique. It's a low friction arthroplasty. He is using metal implants, a polythene socket, which is a gold standard for modern hip replacements. So conventional joint replacement is all about a mechanical guide, a manual instrumentation and a surgeon's visualized technique to balance the knee joint. Initially it was good to see, but somewhere around in this 3 decades, we have observed that around 20 to 25% of the patients were unhappy. And when we have analyzed that, we understood that every patient has a different anatomy. This is Sir Chanley's implants, which was used in 1960. It was only few implants then, and now we have a wide variety of implants with different materials used. So it started from 1891 and now we are in 2025-26 with wide variety of implants, robotics and artificial intelligence. This was how the implants were in the initial days, and if you see now we have very high anatomical dual mobility implants. This is about the hip joint. This is a timeline of arthroplasty evaluation, how we have started and where we are now. These were the implants in the early days, and now we are also using gold implants because most of the patients now they've been into social media and they're personally coming and asking for better implants. So what are the challenges in mechanical conventional arthroplasty? It was all about malalignment, which I was talking earlier. Inconsistent soft tissue balancing, which was a major reason for failures, and revision surgeries due to instability and loosening. So in early 90s and 2000s we have started with navigation, which was better because we were able to know the alignment, how the patient knee joint was, how much bend they were having, how much we have to correct. That was the day it was showing, and this improved the accuracy and the implant positioning. But the limitation was earlier days it was long operative time and it needed a steep learning curve. So this is how navigation system looks. So, how we are different from conventional, and now it is robotics. It's all about robotics. So, the implant positioning is surgeon dependent in conventional, which we were doing earlier, and now it is highly precise because the robotics, as such, in the operation theater, it shows where we are putting the implant and in which position we are putting, and if you are putting in that position, how the longevity of the implant is going to be. So, this all we know even before starting the surgery. And soft tissue balancing is real-time quantified in the surgery. In the intra-op session, when we are seeing, we can measure the balancing, and that shows exactly in the computer. The alignment which we are using now is morely of kinematics or restricted kinematics, which was far better than the mechanical one which we were using earlier. And the learning curve is still very high in robotics, and very few centers in Hyderabad are doing that. Coming to the cost and recovery, yes, I accept that robotics is still higher, but the recovery is much faster. So, robotic combines imaging, navigation, and precise execution. It aims to improve implant alignment and soft tissue balancing, which is very key for better pain-free joint and longevity of the joint. So, we have a few sets of robotics now which are available in India. Few are semi-automatic, few are automatic. And yeah, so this is the one which says the semi-automatic are the ones which is surgeon handheld, and there are automatic which we just need to give data to the robo and it performs the surgery. So here are the robos which are available right now with us. We have been using Stryker Mako, Smith & Vucori, Depu Velis. So how a robotic joint replacement is performed? First, we take 3D planning. Sometimes even we can do it intraoperatively, and we give, every patient has a different anatomy. That is the key, because in mechanical we miss this point, but in robotic every patient's anatomy is taken into consideration, and we try to give a near normal anatomy to the patient. That is why most of the patients are very happy and they feel that they have a normal joint post-operatively. So the limitations and challenges is, it's all about high installation, the maintenance cost, need for surgeon training and adaptation, longer setup and operative time initially, and dependence on technology and infrastructure. And definitely the recovery time has reduced from the conventional arthroplasty which we are doing now. The recovery time is less than 2 weeks in robotics. So future of orthopedics is all about artificial intelligence assisted surgical planning, augmented reality, mixed reality integration, smart implants and sensor technology. Orthopedic has evolved from manual techniques to precision robotics. Robotic represents a paradigm shift in arthroplasty. Technology complements, but it can never replace a surgeon. So I'll end with this small note. AI will not replace orthopedic surgeons, but those surgeons who do not use AI will be replaced by the ones who are using it. Thank you.
India's most trusted orthopedic and robotic joint replacement surgeon 2026 award goes to Dr. Vikram Byre, orthopedic surgeon, Yashoda Hospitals. May I kindly request Dr. Vikram Byre to please come up and receive this prestigious recognition for his excellence in orthopedic surgery, innovation in robotic joint replacement and dedication to patient care.